Hey there, my name is Larissa, and we're going to be working with Lauren today to address her lower legs and her feet. Let's get started. If you can't watch this right now, just add it to your watch later playlist and I'll see you there. Okay, so here we are with the lower leg. And so a little bit of an anatomy review. So here on the back of the leg, we've got her gastrocs. The gastrocs have two sides, and behind the gastrocs is going to be the soleus. And when you're addressing the gastrocs, you can bisect it, or you can work one side at a time. Here on the side of the shin, the lateral side of the shin, we've got first her tibialis anterior, and then we've got her peroneals, peroneus longus and peroneus brevis here on the side. And then looking at the foot, well, looking at the ankle, so these two ankle bones on the side are known as the malleolus. So the one on the inside is the medial malleolus, and the one on the outside is the lateral malleolus. And then working into the foot, the bottom of the foot is going to be the sole of the foot, of course. We've got the arch of the foot here. And then this little area, this ball right here is called the ball of the big toe. So just some landmarks for you as we move through. So we're going to start with the gastrocs. And I'm going to do just a way to warm them up. Hand over hand stroke down. So I'm just using my fingertips to gently pull and traction the muscle down, warming it up a little bit. All of the musculature of the lower leg and feet are so key to work for literally everybody, because we all rely on our lower legs and our feet for walking and stabilizing all the time. So there's nobody that this isn't good for, and there's no condition that it wouldn't help alleviate to some degree. So if your client is open to it, I do highly recommend working through this area, and if they're very brave, I would recommend working deeply through this area. So now that we've warmed up the gastrocs, I'm going to do a move where I'm going to bisect them. So I'm taking my hands under and I'm going to use my fingertips right through the center. So I'm just pushing up, using the weight of the leg to push back down, and pulling down, bisecting the gastrocs. We're pulling it down towards the Achilles tendon. We're not going to, of course, split through the Achilles tendon, but opening up near the ankle is definitely going to be helpful. Of course, you can do that a few times. You can spend a little extra time anywhere that needs it. And then we'll switch over to the lateral shin. I'm going to use my thumb for this, using my safety thumb, starting down low at the ankle. I'm going to be working to start as close to the shin bone as possible. So if you're practicing at home, it's definitely a good idea to feel where you can feel the shin bone and where exactly the muscle tissue is. So yeah, there's the shin, there's the muscle tissue. I'm gonna push down with my safety thumb. I want to feel myself contacting the shin bone the whole time as I push my pressure into the muscle. You'll definitely feel some strange little adhesions as you go. And with this type of work, of course, look at your client, make sure they're not writhing in pain or breathing way too deeply. You want to be working within their comfort level. So that's going to be more the tibialis. As we work farther down, we're working into the perineals. So I'm going to kind of visualize, this was the tibialis, and this is going to be the start of the perineals. So I'm going to visualize going between those two muscles. I feel this groove in between the muscles that I want to get into. So again, using my safety thumb, and this time, you can even close your eyes and just really tune into the sensation of your thumb moving in between those two muscles. Truly, closing your eyes will help you focus and stay there. Anytime you can ask your client to do things like wiggle their toes. If you could for me, Lauren, go ahead, wiggle your toes a little bit. You could have them flex the foot all the way. Go ahead and flex your foot. Well, that's pointing her foot, but yeah, and then back, and then bring your toes all the way back towards your face. Yes, she flexed her foot, and then point your toes. Point your foot, ballerina foot, long ankle. Yeah, so you can have a move like that. Go ahead and relax. Okay, we're gonna do one more strip like that. So we're gonna kind of envision that we're moving between peroneus longus and peroneus brevis. So again, you're feeling those two muscles, and you're going in between them. Try out just a couple more movements. Take some circles. Big circles. Nice. Take them the other direction even. Good. Good. Okay. And relax whenever you're ready. So all of those movements are good to try with any of the moves on the lower leg. So coming from the lower leg, we're going to come down to the ankles here, down to the lateral and medial malleoluses. It's probably malleoli when it's two of them. And we're just going to do these little acupressure points. We're going to go ahead and just do two at once, the one on the lateral and the one on the medial. It's going to be right underneath. You can just feel lightly all the interesting, cool little tendons that are there. And I'm using two to three fingers to kind of just contact them and push them slightly in and down towards the table. And this is going to be really great for opening up the ankle in a pretty gentle way. The ankles are so good to work, but they can be super duper tender. So acupressure points are going to be a great way for your client to be like, that's interesting. You know, they're going to think that's a really interesting thing that she's doing, versus thinking that really hurts and I want to jump off the table. So I definitely recommend looking more into acupressure points. This is a nice, easy one. Okay, so I definitely feel things opening up. We are going to move on. You could spend as long as you want there. We're going to warm up the bottom of the foot. Real simple move, kind of similar to how I was warming up the gastrocs, just using the hand and the tips of the fingers to drag the tissue up towards the toes. Just going hand over hand, getting kind of a sense of what is going on there in the foot. We want to transition from just warming the foot to working the foot therapeutically. So you want to feel like, where is the tension? Like I'm trying to pull her foot kind of long and straight right now. Where are the blockages that are keeping me from doing that? And for Lauren's right foot here, they do seem to mainly be underneath the arch and up to the ball of the big toe. So I probably couldn't spend too much time here. But so getting into how we would find those actual trigger points, I like to hold the lower leg with my opposite hand, my outside hand, my inside hand. I'm going to use the thumb to kind of, there we go, to kind of gently push in. So I'm pushing in and her foot's going out to the side. So I'm pushing in, repeatedly going up the arch and seeing what I find. With trigger points on the foot, it's definitely good to just keep it to maybe 1 or 2. So as you do this, just think, what is the tightest one that I am feeling? Which one has the most restriction? So this one, it's right in the arch of the foot. I can see how pushing it actually pushes the ball of the big toe up. So I know it's going to have a lot of impact. So I'm going to use my safety thumb and work right into it. And I know from looking at her feet earlier that this big toe is just kind of out of alignment. You might be able to see, but so I'm gonna take it and kind of push it into a more healthy, like it should look like that. Right? This knuckle on the big toe shouldn't be hyperextended. There should be a little bit of a curl there, just a little bit, and it doesn't have it because of this tension I'm feeling at the trigger point. So if I give it a curl, I'm even kind of pulling it away now. I can feel that back at the trigger point. So we could definitely spend a long time here opening this up. And it's changing even with just this little bit of work, back to a healthier state. Okay. And that is going to be everything that I have for the lower leg and the feet today. Thank you so much for watching. If you liked this video, then head on over to our Patreon. I'll see you there.
Join us for 14 and 30-day programs, hour-long classes, and much more on our yoga app, Yoga Plus by Psyche Truth. It's free to download and features a variety of wellness content, including yoga, fitness, Pilates, guided meditations, and interviews with dozens of wellness experts.